Hi, my name is Atif Darush, professor and consultant of obstetrics and gynecology. In this short lecture, I would like to highlight the importance of artificial intelligence in the management of cases of endometriosis. As I noticed, many patients and even doctors are waiting for the AI to construct a management plan or diagnostic protocol for any patient of endometriosis. We know that endometriosis is a complex disease. It has gynecologic and non-gynecologic manifestations, and many findings in the diagnosis of endometriosis can be seen in different parts of the body. So how to put all these data of the endometriosis in a computer and say to it, please find the diagnosis and put algorithm for a management plan. This is the target of this lecture. The idea of AI is to use neural network based on neuronal interactions within the human brain, and we train this neural network on data, how to deal with the data, how to handle this data, and to form complex computations like speech recognition, image recognition, uh, informations and interactions, and algorithm forming from natural language prompts. And this figure shows a summary of how to use the AI. The AI idea is to give information to this program to construct a, an algorithm or a diagnosis or a management plan for any disease or any problem. And this needs too much information to be introduced to have the decision or to find out the proper diagnosis. Regarding endometriosis, I summarized to you the publications of AI on endometriosis. They highlight three main points: AI for the diagnosis of endometriosis itself or deep infiltrating endometriosis. And the studies on endometriosis itself relied on giving the neural network, giving it some information regarding the ultrasound findings of the patient or patient's clinical history, blood testing, and markers, spectrometry, uh, and other information about the disease to have an idea about the disease as if it is a brain, human brain, to think of how to diagnose this disease. And the target is to improve the diagnostic tool, increase personalized treatment options, improve post-operative outcome prediction, improve understanding of disease pathophysiology, and staging and accuracy. But actually, these targets are not totally achieved by using AI because the data introduced to this neural network in this study are insufficient. They didn't introduce data about the type of patient, about her parity, about her infertility or fertility, relation to fertility, type of pain, systemic manifestations, hypertension, chest problems, and other problems. So the data are insufficient. So the decision and the diagnosis it will be monovision regarding what you introduce for this program, you will find the results. So the data are insufficient. Regarding deep infiltrating endometriosis, it gives information about is it deep infiltrating endometriosis or not by putting an algorithm, neural net algorithm. But the data you have to give to this program regarding age, presence of adenomyosis, endometriomas, adhesions, kissing ovaries, or and sliding tests by ultrasound. but no data on MRI, no other type of patient information, and no other systemic manifestations of the endometriosis. There are some ongoing studies trying to add the MRI findings to this neural network to have information about the disease and about the MRI pictures you will supply for your patient. But this is an ongoing study. Regarding the AI for decision making in cases of endometriosis, there is an ongoing study relying on transvaginal ultrasonography and MRI to have better diagnosis of endometriosis management, but again, it's deficient in many information that are necessary to stratify and to personalize the treatment of endometriosis, particularly systemic manifestations, GI, gastrointestinal manifestations, surgical, urologic, and other manifestations. And lastly, AI was tried to predict the success of ART in patients of endometriosis and to define whether or not the patient should undergo IVF, and still an ongoing study. So the limitations of using AI in endometriosis are many, including the challenges in terms of training the model, because the data given to these models are insufficient to have an idea about all cases of endometriosis. There is bias and interpretation of data, and this should be balanced by increasing the applicability of AI in medicine, more sampling, external validation, defining parameters, and subjecting these to extensive clinical trials are important. And of course, the AI in endometriosis is associated with ethical and safety concerns regarding the data privacy and confidentiality. Most of these information are open for any person to take this information, and this is not good for privacy of information and the confidentiality. There is bias, and all artificial intelligence trained on limited or non-representative data may misdiagnose or overlook diverse population. As I told you, there are many systemic and gynecologic manifestations of endometriosis are missing. The clinicians and patients may not understand how AI systems reach conclusions and make algorithms. The accountability, which means unclear who is responsible if AI-guided diagnosis or treatment causes harm to the patient. And this is important because if it decides to do surgical intervention and the patient actually has other issues that prevent surgical intervention, so this may carry a risk to the doctor and the hospital in which this operation was done. Clinical validation and safety AI model may not be adequately validated across different populations and healthcare settings. Over-reliance on AI is a potential erosion of clinical judgment and individualized care. If the doctors rely on AI, they will lose their experience for diagnosing and individualization of their patient's treatment. And of course, informed consent and autonomy. Patients may not be aware that AI tools are influencing their diagnosis or management. And this is important. Again, there is no consent from the patients to put their data on the AI. We are publishing, for example, case reports, and the journals always ask us to have consent for publishing this case report, despite it's without their names or personal data. So the AI is inferior to the human intelligence because the diagnostic limitation, lack of surgical, histopathologic, clinical, systemic, and non-gynecologic manifestations or presentations of diseases, lack of integration. AI tools may analyze imaging or symptoms but cannot yet integrate clinical, surgical, hormonal, psychosocial factors like the clinician does. So it's still in its in infancy and it needs many time, many information to be introduced because endometriosis is an enigmatic, complex disease. Also, ethical and safety concerns I already mentioned, complex clinical context, missing pain perception, fertility goals, emotional impacts, and variable lesion behaviors. And of course, patient-centered care is a little bit missing because endometriosis requires communication between the doctor and healthcare providers and the patient, reassurance and individualizing patients. And here in this figure, I designed this figure to show you that endometriosis is not just a gynecologic problem, endometrioma or endometriotic spots or so. Endometriosis affects different parts of the body with body and different diseases, including obstetric problems, gastrointestinal or gastroenterology, surgery, dermatology, pulmonology, cardiovascular, psychiatry, psychology, ER, neurology, and nursing. So all these specialties and all these presentations of endometriosis are missing if you put the data to AI, and it needs too much information to guide you regarding how to treat your case in a better way. And here is an example of one of my slides regarding gynecologic perspectives of endometriosis. We classify them into 5 groups: asymptomatic and symptomatic, including fertility, pain, abnormal bleeding, or infertility plus pain or abnormal bleeding. These presentations are variable, and every patient has her peculiar presentation. And the tools of diagnosis are variable. The studies put ultrasound, and the new one are trying to put MRI. But what about pathology? What about the biomarkers and clinical presentations? That's why human intelligence is superior, because the endometriosis is a complex clinical judgment, interpretation of symptoms, imaging, surgical findings, and patient history. There is incomplete data for AI training. They are not giving the whole data, ethical and safety limitations of AI, clinical empathy and communication, patient support, reassurance, and shared decision making are vital and inherently human. And of course, those patients require individualized care. So in conclusion, I would say that the current role of AI in endometriosis is limited. It's just supportive tool detecting the imaging patterns, suggesting possible diagnosis, or predicting treatment outcome, but you cannot rely on AI in endometriosis. This is not a replacement of human expertise. The doctors should train themselves to individualize the treatment plans, to go through the history in a meticulous way and detect systemic and gynecologic manifestations of endometriosis to detect those patients who are at risk for cardiovascular problems, for malignancy, for other systemic problems of endometriosis. Thank you.